At a time when the spectre of coronavirus still looms large over India, especially in Kerala, which is among the top 5 affected states, the southern state reported India's first case of monkeypox on Thursday. The centre rushed a multidisciplinary team to Kerala after a 35-year-old man from Kollam district tested positive for the disease. As per officials, the man had arrived from UAE on 12th July and was confirmed infected after his samples were sent to the National Institute of Virology. Indecently, Kerala is also where the first case of COVID-19 infection was recorded. On 27 January 2020, a 20-year-old female presented to the emergency department in General Hospital, Thrissur, Kerala, with a one-day history of dry cough and sore throat. It was later reported that the 20-year-old was a student studying in Wuhan University and had travelled to India. The state has seen epidemic of dengue, chikungunya, Kasanur forest disease, West Nile River, H1N1, Nipah, anthrax, coronavirus, prompting many to ask why is the state turning out to be a hot spot of viral attacks. Kerala has witnessed multiple health scares with the outbreak of diseases such as chikungunya, Japanese encephalitis, acute encephalitis syndromes, West Nile encephalitis, dengue, viral hepatitis, Nipah, swine flu and COVID-19. In recent times, the state has also seen cases of Zika virus as well as anthrax. When COVID-19 broke out in the country, it was Kerala that saw the first such infection, as the state witnessed a climb in cases. It declared a health emergency and took significant steps to control the virus. Its handling of the virus and turned it praise with its rigorous and focused testing, containment, community support and contact tracing. However, the situation went very quickly and state started recording high number of infections as well as a high COVID death rate. In July itself, the state has seen a 4-time increase in COVID death from the previous month. The media reported that Kerala's COVID case fatality rate is now 1.21% and the state now leads with the most cases and deaths in the country during the present surge. In September 2021, Kerala also saw a Nipah virus scare when a 12-year-old boy who had contracted the diseases died in a private hospital in Kozhikode. Following the boy's death, public health authorities swung into action, contact tracing friends, family members and health workers. They identified and isolated 251 people including 30 close family members. 11 samples from those in close contact with the boy were sent for testing. However, they tested negative. The death of the boy brought back horrific memories of 2018 when the state recorded 18 confirmed cases in Kozhikode, of which 17 resulted in death. August of last year also saw Kerala health officials batting a Zika virus outbreak. In 2021, the state recorded a total of 66 cases, mostly from Thiruvananthapuram. The first case was confirmed in a 24-year-old pregnant woman on the outskirts of the capital on 8th July. After rigorous screening and testing, the state, as per a Hindu Business Line report on 15th August, declared that the Zika virus outbreak had been brought under control with no cases of new infection. Earlier this month, Kerala health officials also confirmed the presence of anthrax in Athirupalli of Thrissur district. Wild boars have died en masse in the Athirupalli forest area. Subsequently, the health department and animal husbandry department and the forest department conducted an investigation. Samples of these were tested to confirm the case of anthrax infection. Health Minister Veena George had said, one of the main reasons why Kerala is vulnerable to viral attacks could be attributed to the fact the Keralites are spread across the globe. The state is well connected to various parts of the world. A large number of doctors and nurses from Kerala work in various countries. There are students who pursue medical courses abroad. These categories face the occupational hazard of viral attacks. According to an article in the journal Nature, depletion of forest, high population density of domestic animals as well as high population density of humans could be other triggers. Scientists and medical experts mentioned that as human activity encroaches on the natural habitat, there is a greater risk of the transfer of viral pathogens or spillover to humans as wild species are in greater contact with people and domestic animals.